Hay fever, also known as allergic rhinitis, is an allergic condition that affects the upper respiratory system, primarily the nose. It occurs when the immune system overreacts to airborne substances, or allergens, that are normally harmless. Common symptoms include sneezing, runny or stuffy nose, itchy eyes, throat, or ears, and watery eyes. Hay fever is one of the most common allergic disorders worldwide and can affect people of all ages, though it is particularly prevalent in children and young adults. 1. Causes of hay fever. The primary cause of hay fever is the body's allergic reaction to airborne allergens. These allergens can be seasonal or perennial, and they include pollen, the most common trigger. Pollen is released by trees, grasses, and weeds. The timing of exposure to pollen often determines whether hay fever is seasonal or perennial. Spring, tree pollen, oak, birch, cedar. Summer, grass pollen, timothy grass, ryegrass. Fall, weed pollen, ragweed, sagebrush, pigweed. Dust mites, tiny insects that thrive in bedding, carpets, and upholstered furniture. Dust mites are a major cause of perennial hay fever. Mold spores, mold grows in damp areas such as basements, bathrooms, and leaves or compost piles. These spores can trigger symptoms year-round. Pet dander, proteins found in animal skin flakes, saliva, and urine can also be allergens, leading to hay fever symptoms, particularly in homes with pets. Cockroach droppings, the droppings of cockroaches can trigger allergic reactions, particularly in urban areas. Air pollution and tobacco smoke, environmental pollutants and irritants can exacerbate symptoms or increase the susceptibility to hay fever. 2. Symptoms of hay fever. The symptoms of hay fever are similar to those of the common cold, but unlike a cold, hay fever symptoms persist for a long time and are not accompanied by a fever. Common symptoms include nasal symptoms. Sneezing, frequent, repetitive sneezing, especially after exposure to allergens. Runny or stuffy nose, a clear watery discharge or complete nasal congestion. Eye symptoms. Itchy, watery eyes, often referred to as allergic conjunctivitis, where eyes become red, swollen, and irritated. Throat and ear symptoms. Itchy throat, often accompanied by coughing or irritation in the throat. Itchy ears, can also occur, sometimes leading to a feeling of fullness in the ears. Other symptoms. Fatigue, continuous sneezing and congestion, can lead to a lack of sleep, causing tiredness and fatigue. Postnasal drip, mucus dripping down the back of the throat, leading to coughing or throat clearing. Headaches, sinus pressure can contribute to headaches. 3. Diagnosis of hay fever. Diagnosing hay fever typically involves a combination of medical history, physical examination, and sometimes allergy testing. The doctor will ask about the timing, frequency, and severity of symptoms, as well as any potential triggers. Tests used to diagnose hay fever include skin prick test. Small amounts of allergens are applied to the skin, and if the person is allergic, a raised, itchy bump will form. Blood tests. These tests measure the level of immunoglobulin E, IgA, antibodies, which are produced by the immune system in response to allergens. 4. Treatment options. Although hay fever cannot be cured, its symptoms can be managed with various treatment strategies. A. Avoiding triggers. The most effective way to manage hay fever is to avoid exposure to the allergens that trigger symptoms. Some common strategies include keeping windows closed during high pollen seasons, using air purifiers to reduce allergens indoors, avoiding outdoor activities when pollen counts are high, washing hands and face after being outdoors, keeping pets out of bedrooms and off furniture. B. Medications. Various medications can help control the symptoms of hay fever, including antihistamines. These medications block histamine, a substance that triggers allergy symptoms. Antihistamines are available in oral forms, tablets, liquids, or nasal sprays and can be effective for sneezing, runny nose, and itchy eyes. Nasal steroids. Corticosteroid nasal sprays reduce inflammation in the nasal passages and are effective for controlling congestion and runny nose. Decongestants. These can provide temporary relief from nasal congestion, but should not be used for more than a few days due to the risk of rebound congestion. Leukotriene modifiers. These medications block chemicals that cause allergy symptoms and are sometimes prescribed for hay fever. Eye drops. Antihistamine or anti-inflammatory eye drops can relieve itchy, watery eyes. C. Immunotherapy, allergy shots. Immunotherapy involves receiving regular injections of allergens to desensitize the immune system. Over time, the body becomes less reactive to the allergens. Immunotherapy is particularly useful for those with persistent symptoms that don't respond well to other treatments. It can take several months or years to see full results, but it provides long-term relief for many patients. D. Alternative treatments. Some people find relief from hay fever symptoms using natural or complementary therapies. These may include saline nasal irrigation. Rinsing the nasal passages with a saline solution can help clear out allergens and reduce congestion. Herbal remedies. Some herbs, such as butterbur and stinging nettle, are thought to have natural antihistamine effects, though more research is needed. Acupuncture. There is some evidence that acupuncture may help alleviate hay fever symptoms in certain individuals. 5. Prevention of hay fever. While it may not be entirely possible to prevent hay fever, certain steps can reduce the likelihood of developing it or minimize its impact. Early exposure to allergens. Studies suggest that early exposure to allergens in childhood, such as pollen, may help build tolerance and reduce the risk of developing hay fever. Allergy-proofing your